Folks, that today's session will be recorded, and I want to officially welcome everyone and to remind you that today's meeting is hosted by DBHR through the Washington State Healthcare Authority, and we expect this to be as interactive as usual. Please feel free to share your observations and ask questions as we go along. Want to make sure that the session is providing information and also responding to your specific circumstances. As we know, even though the subject is very much a very popular and general one, the concept of hoarding and challenges related to it can be very unique and nuanced to specific circumstances. Once again, I want to remind you that the presentation and a recording I know will be available to you via the FCS YouTube channel, but we'll try to get the copy of the presentation, at least a link to that presentation in the chat. And I'm going to ask my colleague Crystal if she can, and I forgot to do that, but I'll ask Crystal if she can make a link to the copy of the today's presentation and put it in the chat so it'll be available to you. All right, all right, all right. So let's get this ball rolling. So today's session is going to be focused on chapter 6 of the book or reference that we use, Buried in Treasure. And for today's learning community, we're going to be focused on how did this happen? How did we get to this point? When hoarding or a challenge with managing clutter becomes so significant that it becomes a primary concern and has significant impact on one's well-being, living conditions, and to such a degree that we are really significantly impacted by both the clutter and the hoarding behavior and the impact of it in all aspects of our lives. So how did we get there? How did we get from where we used to be to where we are now, so significantly impacted by hoarding concerns? So generally speaking, this chapter is really designed, and all the discussion around it is really designed to help you understand hoarding from what it is, and the concept that it's truly more than simply a collection of items to the extent of which somebody cannot function or is not functioning as desired or intended in their living environment. But hoarding really speaks to problem of emotional, mental, behavioral, and social well-being. So it really impacts all dimensions of that person's life to the extent to which their functioning and well-being is severely and significantly impacted. We will today look at really how the development of hoarding ensues and how it begins truly in terms of its foundation. The major aspect of the problem really starts in our brain and in the manner in which we conceptualize things, the manner in which we really look at how we are living our lives and how we're viewing the world through those lens, and how it really lends itself from that kind of cognition to how we think and to how we feel, and subsequently is to how we behave that results in significant impairment as it relates to hoarding. So it really looks at the trajectory and the path to which we get to the point where hoarding is a significant and major concern in our lives. So we're really taking a retrospective look as well as really truly understanding the path in which we travel to get to the point of it being a significant disorder in our lives. And thank you, Crystal. Crystal shared the PDF copy of today's presentation in the chat, so you can certainly access it now or when you're ready to do so. So let's take a look at that. And before we do, I want to remind you that artificial intelligence really, as it relates to our particular presentation, you have to have authorization from the DBHR to use tools of that sort. So be wary of that and certainly respect that guideline. Once again, materials and recordings will be available to you. We just put the presentation in the chat, and the copy of the recording will be sent out to all the participants and will be presented as well on the FCS YouTube channel. So look out for that.
I like that. That's good.
Yes, we can share it in the chat. I know sometimes it is tough to get to it if you've missed it again. We'll repeat that share in the chat of the presentation. So hold tight. So once again, we've transitioned or traversed from the introduction of what is hoarding to the point of where we are now in terms of really taking a conscientious look at how did this happen? How did we get here? So we're really focused on chapter 6. So we're going to do initially a review to get a reminder and kind of a foundation as to what we did last month. And I'm certainly grateful Crystal facilitated last month's training, and feedback is everyone positively responded and really enjoyed that presentation. So I'm hoping that you're able to really take what you learned from last month's session into today's session and really carefully walk that path along. So from December, we spoke about meeting the good guys. And when we speak of the good guys as it relates to buried in treasure, we're talking specifically about strategies that really help us address hoarding concerns. What are some of the actions? What are some of the behaviors? What are some of the thinking patterns that allow us to really see hoarding for what it is and determine approaches and strategies and way in which we can begin to address it. We can begin to recognize the need to make substantial and specific changes that really allow us to become more functional in our environment, understand how hoarding impacts our thinking and our behavior, and really begin to make some remediation around those challenges. So when we talk about the good guys, we're talking about a number of strategies that we really focus on to help us not only be cognizant of the impact of hoarding, but really begin those initial steps as to addressing those concerns. So we talk about the first good guy, we talk about eyes on the prize, or how do we maintain a key awareness of the hoarding problem as it exists in our lives. And the purpose of that is to really keep our motivation alive, especially when letting go of our possessions feels difficult to do. So we want to keep our attention, keep our focus on the prize, really have a succinct, concrete focus on the challenges ahead of us and how do we address them. We want to make sure that we have a sense of true understanding of how our beliefs and how those beliefs that we have about our relationship with our possessions can impact our ability to manage or to remove or reduce clutter in our lives. We also look at thinking it through. How do we talk our way through the decision-making process to determine how do we manage our possessions to the extent at which we do not either increase or sustain clutter to the extent that we can't function in our living environment. So we really look concretely at some of the strategies to address those concerns. And we look at those positive habits to address hoarding behaviors as they exist. So I hope that that provides kind of a clear reminder as to what we talked about last month. And what I would kindly ask folks to do is if you would kindly mute if you're not addressing the audience so that we can have the benefit of a clear communication. I'd appreciate it. So what we also want to focus on last month is really how providers can be part of the team to address clutter. How do you support, motivate, and help people sustain their efforts to address those concerns that are produced by hoarding behaviors? So we looked at the strategies as to how we can address those concerns, and then how do we, as staff and providers, support and assist people in maintaining and managing those concerns. So we also have the presentation there as well. We As usual, at the end of each month session, we look at the learning application. And specific to last month, we ask you to look at an assessment tool that we call Thinking It Through. How do you really address the process of really addressing those hoarding concerns? So we hope folks had the opportunity to try out that assessment. And if you did, was thinking it through that assessment process, was it helpful in your endeavors? And what feedback do you have from either reviewing that particular tool or putting it into practice? Did anyone have the opportunity to use the Thinking It Through assessment tool? And if you did, what was your findings? What is the feedback you have? I want to also reinforce the reality that when we a major part of this learning community, a major part of really going through these sessions and really having this discourse is for you to take that theoretical frame of reference, that discourse, and put it into practice so that you can come back and really tease out whether or not it was beneficial to you. You were able to use it, you made sense of it, it had a significant impact, and to process how we can continue to learn collectively from your practice, as well as see how best we can attune what we've learned to your specific concerns and conditions of your clientele so that we are making this particular learning community learning and practicing element as fortuitous and beneficial as we can to you in your unique circumstance. So we know we have folks who may be joining us for the first time. Thank you. But we also ask that if you can do some review of the previous session so you kind of stay on track with us. And Crystal put in the link the Thinking It Through activity. So if you haven't had a chance to use it, you can try it so you can provide some feedback to us next time we meet. Someone said, I appreciate the wide range of tools that were offered in helping clients take that tiny next step. Absolutely. It's very gradual in process. Addressing hoarding is an ongoing, very, very specific, oftentimes very, slow pace, concrete kind of changes. And Taylor said, I use it for my own personal life and it was very helpful. I haven't had a client to utilize it with yet. Well, Taylor, sometimes that's the greatest source, right? When we try it out ourselves and see how we navigate it, how it impacted us, it gives us a greater insight into how it may be applied to other people and also give us a point of compassion that we can use when we're engaging with other folks that we're either serving or supporting. So it's a great place to start. But if you haven't had the opportunity to use that activity tool, please do so as early as you can and provide some feedback along the way. Jennifer says, awesome tool. Biggest barriers I've seen to clutter is emotional attachment. Absolutely. You're spot on, Jennifer. It's probably the most common retort or feedback you get from folks. I can't let go or I can't determine what to do with this item because it's part of me. I feel so connected to it. It reminds me of this. It's the only memory I have of this person. It's a reminder of when I was happy, when I was in a good place, when I had people in my life, lots of other reasons. But it really has that emotional connection that people have a difficult time navigating and managing. So thank you for sharing your feedback. Let's get into today's focus. What do we hope the takeaway is from today? Very concrete as best as we can. We want to distinguish cognitive impairments associated with hoarding. What are some of the thoughts and the kind of cognitive concepts that are really challenged or impaired by hoarding behavior? We want to identify hoarding behavior reinforcement patterns in thoughts, in feelings, and actions. What keep People doing what they're doing despite the negative impact or despite the impairments that results. Want to have a better understanding as to what that looks like. What is the chain analysis that leads to that kind of thinking and behavior? And Larry says, I'm always afraid if I throw things out, I will all of a sudden need it, even though it has been taking up space for years without me using it. Absolutely. And that's a very common feedback as well, right? How many of us don't have jeans in our wardrobe or our closet that we still haven't been able to fit in 5 years, but we are sure that at some point in the near future, we're going to be able to rock those jeans because, yes, our willpower will get us there, right? Or it reminds us of when we were at our optimum physical self. And that's the reason for holding on to it because if you can ever fit that jeans, we will be reminded as to the best of ourselves. Jennifer says, yes. You know the feeling? Absolutely. I've still got some shoes, like I've always said, that I know fully well that if I ever fit into them, I will be reminded of exactly where I were in time when I bought them, right? I want to recall that first joy, that first uh, exultation, that first euphoric feeling when I bought those shoes. If I can only fit them, my life would be exactly where it was when I bought them. Indeed. As irrational as it is a true feeling. It is a true thing that we hold on to. And I donate all my things that didn't fit, except one pair of jeans, just in case. Absolutely, we have to hold on to that one. That could be it. That could be the one that brings us back to, our best selves. Absolutely, Lisa. Lisa says my 93-year-old mother tells me it's sentimental. Yes, we spoke about the sentimental attachment to some of the most what may appear to be insignificant items to items that are very tangible and concrete for folks. It happens. Oh, yes, I've heard that before as well, right? It will come back in fashion, it will come back around, so you're still holding on to your bell-bottom jeans from the 70s. That's fine. Examine a tool to assess your reasons for clutter. So really look at what are the concrete, tangible reasons that you use or you have for holding on to stuff beyond its utility. And that's important for us to recognize that that's part of the misnomer about really connecting with our items to that extent. Absolutely. So we hope that we can certainly meet those expectations and
Yes,
also you
ma'am.
have some tangible takeaway related to it. Was someone going to share? I think I heard someone, but okay. But yes, Bliss, one part of this, what is a great thing about this particular learning community is once we share those things, we realize, hold on a minute, I'm not the only person in this specific realm, or it is not only my clients who are experiencing this. Sometimes it gives us that sense that we're not alone in the challenge. We're not alone in the circumstance in which we're still continuing to fight the battle, right? Sometimes having that commonality and that familiarity allows us to feel a lot more reasonable in our efforts to continue fighting the battle. So, uh, it's important to understand and to consider and to recognize that hoarding behavior is really a mental health issue. It's not merely a physical collection of stuff issue alone. It is not simply a matter of just having too much stuff. So it's important to start this journey of change and um, addressing our concern by recognizing that hoarding is a mental health challenge. And as we know with most mental health challenges, it takes time, effort, skills, knowledge, and the appropriate resource to address and to sustain. And the process of recovery is a deliberate one that may take a lot more time than we anticipate, but is doable. It's achievable if we develop and acquire the appropriate and sustainable knowledge, skills, and resources. Hoarding is not just a house problem. it's also a people problem, right? It's all encompassing who we are, how we exist in the world, and how we manage our thought, feelings, and behaviors. People are not entirely in control of their behavior once they're faced with these issues. And it's important to recognize that so that you don't haphazardly or with good intentions sometimes make the mistake of assuming that someone's behavior is just aberrant or they're just lazy or they don't want to take control or be accountable. It's more than that. Someone is not inherently lazy or stubborn because they're exhibiting this behavior. And oftentimes, making this change to sustain that ability to maintain your items in a way that is not cluttered and is not impeding your functioning requires restructuring thoughts, feelings, and behaviors. It's a triumphant of efforts we have to make. We have to really recognize the thoughts that sustain that behavior and change those. We have to recognize how the feelings that we have may be distorted to the extent that it's resulting in behaviors that we don't intend to engage in. I hope that lends itself to a better understanding as to the scope of the problem and the extent to which the action is required to change it. And Lisa says it's spot on. It's about radical acceptance, right? You have to be able to accept that people are so significantly compromised, not simply in their physical action or behavior, but in thoughts and feelings that result in hoarding behavior being sustained. So it's important to remember whenever you feel overwhelmed or you feel challenged by your ability or your lack of ability or success at supporting someone, that hoarding is really a problem of emotional, mental behavior and social well-being. It's not merely someone simply behaving in a way that is contradictory to what they need. It's a lot more than that. Does that make sense? Does that resonate with you? That understanding that hoarding is a very complex condition. It really, you know, attacks a lot of areas in our lives that are significant to manage. Fantastic. And I think once you have that understanding, it's easier to be compassionate and aware and also be realistic with what you're taking on as a person attempting to support and assist someone. And also help that person recognize that there's no magical approach to doing this. It seldom changes overnight. So sometimes you have to help the person modulate or moderate their own expectations about change. And that's oftentimes a major part of what we do, really helping people understand that if it, that's our old saying, if it takes 50 yards into the forest, it will take 50 yards to get out. It's a process. So let's look at what happens in your brain, hoarding in your brain. Research has shown there's been brain scans for people who have had significant hoarding behavior, and we've seen some evidence. We've seen folks who have done an fMRI, which is a very complex and scientific approach to really scanning folks' brain, the frontal and temporal lobes of people with a hoarding disorder. And what we found is certain brain activity that's very distinctive. First, we find that for many people who have severe hoarding disorder, brain activity differs from those without hoarding in two significant ways. Folks who are really impacted by hoarding, we often see overactive brain functions. People are so engrossed in making all those decisions, everything seems important, everything is relevant, everything is consequential. People have a difficult time really processing those elements of brain functioning as executive functioning to the extent that everything seems overwhelming, complex, and challenging. People are oftentimes having a struggle making those decisions about what to do, how to do it, when to do it, why they should do it, and with whom they should do it, oftentimes. And then we have the concept and the reality that sometimes external observation about clutter may not register to that person as a problem. So oftentimes when we think of why can that person see the conditions in which they're living is problematic, and we just assume that they're ignoring it or they just have this lack of reality, when in essence it's a major problem with really their cognitive functioning to the extent that they can make the same deduction that you're making. Absolutely, Larry. Larry says, I have a scarcity mindset that I can't seem to get over. Yes, we have a lot of folks who can see one thing and have a totally different cognition about it or conceptualization of it. So there's a lot of overactivity in the brain functioning of people who are substantially or significantly impacted by hoarding. And then we also have underactive brain functioning, where decision related to possession judgment is compromised. So, like I said, and reinforce here, it's a significant amount of really challenging brain activity and cognition that lends itself to sustained hoarding behavior. People have a difficult time making decisions. Oftentimes, you get report from folks that the brain is screaming and everything seems important and hard to make even the simplest decisions. And that can impact how people feel and think and behave and the scope of their normal decision making. Very good question, Don. Does this apply to people struggling with digital hoarding? I am absolutely not certain that whether or not there's a differentiation in the type of hoarding, but what we've learned is that folks who really are significantly impaired by hoarding in many different ways have that similar brain activity or brain functioning or brain dysfunction. But I certainly will do further review of that. That's a very good question, Don. Whether or not it really aligns with folks who have digital hoarding behavior. And I think Crystal is spot on in the sense that the problem is not really seeing the issue. It's what the brain assigns too much importance and threat to items and discarding them. Yes, it's really the brain getting into that ultra hyperactivity, that protective mode where sometimes making the most practical decision or viewing things in a manner that would be perceived to be rational is impaired.
What's that?
Question is, when you mean underactive brain function, do you mean like nothing is important, but process of getting rid of things cause the hoarding? It's more than just, I think it's actually not so much about nothing is important, is that oftentimes is that people can't seem to make the connection between what is relevant, what is significant for them to address. So it's really about how they view stuff. Everything seems so important that any decision can be crippling. So it's like a concept of indecision on steroids. So that's a lot going on in the brain, and there's still ongoing research. So we're still learning so much about what's happening in the brain. We look at cognitive functioning and how that's impacted by hoarding behaviors. And this would give you some more specificity to what we just kind of laid out as a general concept, right? People who hoard and who have significant challenges with hoarding have problems with attention. So there's lots of intense distraction that comes on, right? Or people have a tendency of becoming hyper focused on specific things. Hence why we see oftentimes when we speak to someone, a good example is you're working with someone, you're like, let's just address making decisions about what we're going to do with these items in on the kitchen table. And then it becomes a significant difficulty for folks to just focus on the items in the kitchen, on the kitchen table, right? We talk about, well, if I move this particular cup, I have four others in the living room that makes a set, and therefore I can't make a decision about it, or something of that sort, where it becomes so difficult to focus to get from observation to planning and to decision making, or decision making and planning. There's something that oftentimes impede the process of moving even to a three-step process. It is so hard to focus one attention on a specific set of steps to get an outcome. Or oftentimes people become so hyper-focused on one element of the whole of the problem and it becomes a difficulty. A classic example when we often say to folks, but we observe that you have 12 scissors. Why do you think you need to have this amount of scissors? Well, I've gotten this one during this time and that one at that time, and this one has a handle, and this one I'm trying to repair, and they can't seem to focus on the 12 scissors as opposed to what each and every one of them relates to in terms of significance. Problems with categorization. Many small categories, few items, or a lack of categories. So we have kind of a cacophony of different issues. For example, if you're asking someone, you're working with someone and you're trying to make a decision about how do we discard items. Classic example, you have the garbage can, you want to decide on the garbage, recycling, and those that you're going to give to Goodwill. Before you know it, the person starts processing even those three items into five different items, all right, or five different categories. Well, even if I'm taking it to Goodwill, I want to make sure that, they're divided into clothing, furniture, papers, and five different categories just under um, the Goodwill category. Then there's five categories under the trash categories. Then there's five other categories under the recycling. Before you know it, the categories become so numerous, so overwhelming that you never get to the point of actually putting it in the bin or taking it to Goodwill. Problems with decision making is another cognitive functioning that becomes significantly impacted or impaired. We're indecisive about stuff. How do I give up this and then the other one remains? If I give up the wheelbarrow, then how do I get A, B, C, D happen? If I give up this pair of jeans, how do I then deal with the idea that this was the jeans I wore at my first date? How do I relate to my first date without having these jeans as a cue, as a physical reminder as to how delighted I felt when I went on my first date? Decision making can become impaired by what may seem like the simplest concepts. Problems with memory, all types of tasks, or too many visual reminders. Things
AAA,
become
this
very
is Maria. How can I
confusing.
help you?
So we have to be conscientious when we are trying to support folks. We have an understanding clearly that a lot of cognitive functions are impacted. It's not merely someone's unwillingness to make a decision. Oftentimes, It is about all these activities that are occurring in their brain that can sometimes create significant um, impediments or obstacles to making some of the most basic decisions. Whether it's attention, whether it's over categorizing, whether it's making those decisions, or having the skill to make those decisions, or have the commitment to make those decisions, to really having a good memory of what they want to do and why they want to do what they want to do. And so I know the scissors often brings up a lot of memory with folks. Yes, scissors, chopsticks. I mean, you can have a litany of stuff that you haven't used in a year, and you're still like, nope, that one that I bought is important. I want the chopstick with the blue cover. That one worked well 5 winters ago. We want to look from the cognitive function into what goes on in your thoughts. What are some of the bad guys that still, I often say, still have a party in your head and in your mind? It's those entrenched and inflexible thoughts. When faced with difficult decision making about what to keep, what to discard, what to acquire or to leave, most people struggles with some thoughts, right? And I think we've had some examples shared already. This might be useful. I can't get rid of it until A, B, C, D. I don't want to make the wrong decision about whether I should get rid of this bank statement or whether I should rely on a virtual bank statement or a oftentimes they're like, I can't rely on that. What if the I have a blackout or electricity outage or I can't get on the internet and someone calls and I need that information immediately. Then I'm going to regret getting rid of the paper bill. And before you know it, nothing gets done. I love that, Jennifer. Jennifer said you're measuring time in winters is too long. Absolutely. But this is the reality of what happens to someone who's significantly impaired by hoarding. Classic one. This particular item gives me a sense of security. I'm holding on to this 15 photos of my grandmother because this is the only memory I have of her. This is what keeps me connected to her. This is what I use when I miss her. And half of the time, the photos may be faded, or it may not be something that you can certainly remember your grandmother by when she was, in a place where you had that relationship. Sometimes a photo of when your grandmother was 12 years old and you've never seen her in that mode, sometimes that can be challenging to let go of. So beliefs of usefulness, waste, and responsibility. Oftentimes people tend to believe, I cannot get rid of all these things. It's going to harm the environment. I need to do it slowly and gradually over 2 years. And it's like, no, you've got the recycling bin can take up a lot. You don't have to worry about how much recycling the whole world is doing if you're trying to get rid of the stuff that is impeding your functioning. Sometimes it's that concept of being frugal or environmentally conscious. I want to hold on to all these plastic containers because the world is overrun by plastics, and therefore, if I get rid of them now, I'm hurting the earth. Lots of rationalizations that impede decision making. Over creative thinking. You start thinking of all the ways I'm going to have 15 different containers or baskets to store everything in. Then I have to remember all those different categories. Where did I put? What bin do I put my phone bills in as opposed to my credit card bills as opposed to my housing bill? And before you know it, you have so much categories you can't remember how you've stored stuff. Perfectionism. One of the challenges that we often overlook or we're not aware of. Oftentimes, people who are significantly impaired by hoarding They strive for perfection in resolving the issue. Every decision has to be the right decision at the right time in order for them to believe it's possible to make that change. And it lends itself to indecision or just avoiding the decision altogether. If I can't get the absolute right categories to determine how I'm getting rid of my stuff, then I'm not going to start at all. Because everything has to be in its right place in the right category, otherwise, I've failed. So that oftentimes happen where we have folks who are trying to make perfect decisions about change and about managing their possessions, that it leads to impediment and obstacles to making a single decision. So perfectionism in this particular case, when it relates to hoarding, is an impediment, a significant, substantial impediment that leads to a lack of decision making or avoiding decisions altogether. So it's important to recognize what's going on in both your mind and in your brain that really impacts your ability oftentimes to address hoarding in a tangible, sustainable, meaningful approach. What are some other examples that you may have of inflexible thought that you have encountered where people can't seem to get past certain thinking and lends itself to either a lack of decision making or a lack of movement towards making change? What are some other examples that you may have or you may have encountered or seen or observed in the people you serve? Just think about that and certainly share if you can. But it's important for you to try to reconcile and remember some of the signs that you see when you may have felt that the person was really stuck in their thoughts and unable to make those decisions or unable to even process things. Absolutely. Yes, we can oftentimes be stuck in that concept of I can't make this decision because A, B, C, D, and it's going to impact A, B, C, D if I make this single decision. And then it leads to decision paralysis, so to speak. So we move from that to how do we get into our emotion to the extent where that becomes an impediment? Oftentimes, making the decision to change our behavior or to address hoarding can lend itself to general emotional displeasure, feeling sad and irritable. How did I get here? How ashamed I am. How must that person be viewing me? The fact that my home, I can't even walk around, I can't even exit, I can't even use my living room, I can't use my bedroom. So oftentimes we find people really stuck in those negative emotions and it impacts their ability to even think about making a change. And then there's that motivation to relieve unpleasant feelings. I feel sad if I possess something, if I buy something or collect something, it makes me feel better because I feel like I've won something. I feel if I possess something, I feel that I've added to my collection. I've added to my set of things that I have that I can use. That lends itself to people further engaging in the behavior. Then, as we commonly talk about here, there's a sentimental attachment that becomes a challenge. And it's funny because one of the things that we just assume is that if we think it should be sentimental, then it should be, or it shouldn't be. And we use our own value system sometimes to assess that person's possession and that person's relation to their possession. Big mistake. Oftentimes, not a principle and a successful way of addressing things. People can have sentimental attachment to things that may not make sense to us. Sometimes people may have an attachment to what may appear to be the most innocuous items. And I'll give you an example. And don't you judge me. Growing up as a child, in my society that I grew up in, having a can of sardines was a big item. And it was more than simply the fact that it was a great source of protein and it was easily stored. My parents and my parents' parents, and I think generations before my parents, sardine was a survival tool. If you had a can of sardines in your larder or in your cupboard, you could never go hungry. And my parents and their parents grew up in a time when hunger was prominent. And we oftentimes eat the Mediterranean diet. So the concept of having sardines was considered to be a good sign of healthy, thoughtful, practical application in your living circumstance. So what did you think happened? I couldn't seem to get away from always having cans of sardines, and oftentimes I would forget that I bought them and they would expire, and then I would have five expired, five new, and five I'm still planning to buy. At some point, I had to recognize that things have changed to the extent where you can have a sustainable life, you can maintain security and a sense of all that stuff without holding on to 15 cans of sardine. I don't love it. I know. There's some folks where I come from say sardine never expire, right? But yes, they do. They have an expiration date. But that's the reality of things for some people. A sentimental attachment to stuff that may not make sense to other people. People may be holding on to a vase or a particular photo or a particular stuff that has a sentimental value that you may not be able to understand. Sometimes they can't explain it practically, but they understand the feeling associated with it. A feeling of identity oftentimes can also be part of that emotional connection. Something called anthropomorphism, which is the act of thinking of something or relating to something as though it has feelings, it has a desire. People can hold on to things of that sort. A photo can actually have that kind of impact on folks. This photo reminds me of when I was in love, when I was happy, when I was connected to the world, when I had value and purpose. It can be a watch, it can be so many different items that people connect optimism, optimum functioning, love, all kinds of really strong positive emotion to that is very difficult for you to understand. And you can't get rid of it in a rational sense because they associate it with feelings and thoughts, and it's like a person in their lives. So these are some of the emotional concepts that really lend themselves to people holding on to possessions and having a difficult time addressing that kind of clutter and hoarding behavior. So when we speak to moving from cognition to emotion to behavior, we have to understand clearly that clutter has a behavior connection. Possessions evoke strong emotions. How many of us can relate to the fact that when you buy a new shiny or a new item that you longed for, that positive emotion, that elation, that exhilaration that is attached to the purchase of that stuff? How many of us could connect to buying something that really elevates our emotion to the point where we feel like we're a new person because we possess this stuff? Or we're a better person, or we're a happier person? Think of that. Have you felt that way when you possess something, when you purchase it, or when you received it, whether it's a gift, something you purchase, something you acquire, something you inherit. Love it. Even a haircut. Very few times do I hear people saying, well, I don't feel good by buying that. Most of the times there's a positive emotion attached to the purchase or acquisition of something of that sort. And that kind of emotion, that kind of can lead to behavior that is repetitious, right? We can do it over and over again to get that emotion, that emotional feeling. And oftentimes, what happens is we keep chasing that emotional high over and over and over again. And it leads itself to a loop, a reinforcement loop. What happens oftentimes is when we're feeling down and we acquire something, we feel a sense of relief. And it protects us from that negative feeling that we had prior to acquiring that stuff. And we get that payoff, the good feelings that come from acquiring it. And that reinforces that behavior over and over again. If it makes me feel good, I will do it over again. Yes, the dopamine hit, right? You get it's like an addiction. Absolutely. You keep chasing that high. And that's how the behavior gets reinforced and repeated. Or it may not, it may be more than simply acquiring something. It could simply be looking at an item that you have a sentimental attachment to and you feel that surge of positive emotions and it reminds you to hold on to it and to actually acquire another one or go find something similar and place them in a place where you can just view them and have that emotional high. So the behavior is reinforced by the feeling and the thoughts and all the cognition that you have. Want you to keep track of that connection that we talked about initially. You can track it and trace it back and forth based on where do you get the payoff and the relief from. So when we speak to that, we speak of the reinforcement of hoarding behaviors. And that's what we talk about, that reinforcement loop. From the feeling, the emotional discomfort that lends itself to the positive thoughts of if I acquire something, I'm going to feel better. And therefore it lends to I need that stuff because I know if I acquire it, the last time I acquired something, I felt a positive surge of emotion. And therefore I think I just need to get something and I'm going to feel better. And then we acquire that stuff. And we have to do it over and over again to keep that positive emotion either elevated or reinforced. And then it leads to the continuous behavior of acquiring things, which results in clutter. And then we constantly find ourselves going over and over through that loop. Does that sound familiar? Does that make sense to you? How we can have that reinforcement loop of thoughts, feelings, and behaviors that lends itself to maintaining hoarding behavior, even if we know rationally that's not what we want to do. Can you see the connection between the cognition, the thoughts, the emotions, the behavior, and that reinforcement? Fantastic. That's important to recognize. It then lends itself to us realizing we just can't intervene in one area and believe that we can break that loop or stop someone from going through all those processes. We have to attack it in all those areas in order to really have a sustainable way of making that change. So when we are often reminded that clutter behavior patterns are outcomes of negative and positive feelings, right? The negative feeling, result of the positive feeling from acquiring, and then it gets that reinforcement over and over again. So how do we put this all together? How do we recognize, reconcile, and address it from the understanding that hoarding is a complex phenomenon that can be different from person to person? Each person may be reinforced differently, may have a different way of addressing their emotions, may have a different way of how it makes them feel, may have a different way of how it lends itself to behavior that are problematic. There are lots of different reasons to hoard. Emotional attachment, unhelpful belief about possessions, problems processing information, difficulty with attention, difficulty making decisions about what to hold on to, what to get rid of, how much is a good number of scissors to keep, how much is a good number of jeans to keep. Should I keep the jeans from when I was young or should I hold on to the ones now? Very challenging decisions. How do we get those feelings and actions and behavior reinforced? Do we do we strive so much to avoid or relieve unpleasant feelings that we use acquisition to actually reinforce or to reward ourselves from those negative emotions? How behavioral patterns impact our ability to change hoarding behavior? Do we avoid discarding because we're fearful that we may get rid of something we need at a later time, or this stuff may have too much sentimental value for you even to make a decision about? Or you're at a point where you feel so overwhelmed by your possessions that you don't feel you can ever make an inroad into getting rid of it because it's so much. You feel overwhelmed. And it all results in clutter, increased clutter, or sustained clutter. So we have to put those things together to understand the full realm of what's going on in someone's mind, in someone's thoughts, someone's behavior that results in hoarding. So we have to have an understanding of the reason of clutter or the reasons for clutter. It's emotional attachment and unhelpful beliefs about the possessions, problems processing information, and those things that reinforce that behavior that leads to certain behavior patterns that oftentimes results in cluttering. If you can make that connection, you can see different aspects of that person's thoughts, behaviors, feelings, and how it impacts their ability to make changes to sustain their behavior as such. So we understand clearly that we have to tackle all those different dimensions in order to have someone truly make sustainable change. And it's very different from person to person. Different things may be impacting that person and lending itself to either maintaining the hoarding behavior or having the readiness and commitment to change. Now, it may be easy for you to believe that, Earl, if all of this is happening, then it may be impossible for someone to change. Not necessarily true. What it means is that you don't underestimate what it's going to take to help that person sustain change, or you overestimate your capacity to support and help that person in a meaningful way. And we'll take a look at a quick case example here and try to make sense of it. So I want you to think about this. When Bill goes to a flea market and finds a bargain, he feels a sense of delight. He congratulates himself on finding this treasure and experiences what he calls the thrill of the victory. It's easy to see how this good feeling can be a powerful motivator. Who doesn't want to feel victorious and triumphant, right? Now, Bill feels like he's likely to keep going back again and again in search of that feeling. Of course, the feeling never lasts long, right? Sometimes a few hours after, sometimes as soon as he leaves that stuff, he feels like, oh, even though I feel that thrill of acquiring that stuff for less than I thought it was going to cost me, now I've spent more money that I was supposed to spend on my bills. I was supposed to do something else, and I feel that whole loop starting again. Pleasure from acquiring it, frustration with myself for making poor financial decisions, fear about the impact it may have on the rest of my life. When Bill gets home with his new possessions, he quickly realizes he has no place to put it. Frustrated and confused, he tosses it on top of the pile and eventually forgets about it. You might ask, Why don't Bill's feeling of frustration, confusion, and unhappiness with the clutter in his home serve as a deterrent to acquiring more things? If you feel this way and you keep repeating this behavior, don't you think it's time to change? Now, for the same reason that hangovers are not powerful deterrents for people with drinking problems, the same applies to bills acquiring stuff. We all tend to be motivated most strongly by immediate rather than delayed consequences. This is a big part of the problem. So instead of being able to step back and appreciate the long term consequences of our actions, we become slaves to the here and now. Can you make sense of that? Can you resonate with that? What Bill is going through? And I see a lot of folks can relate to it in terms of the addiction concepts, right? And the same kind of conceptualization, but it's a tremendously powerful loop, a powerful emotional connection that drives this behavior. And it's important to recognize that. Think of what are some of the reasons for Bill's hoarding behavior and behavior patterns. What do you see in that? What do you hear in that? What do you make sense connection to when you speak to Bill's behavior of going back and forth, acquiring things, feeling, immediate positive emotions and then the negative emotions when he goes home, and yet he keeps repeating that pattern. And someone says, house plants are my thing. I buy more house plants. I have no space in my house. I have to start moving my couch to put plants. I know the feeling. That's unique. That's a great perspective, Alana. Like a cycle of abuse almost. Yes, to some extent, yeah. Absolutely. Sometimes future thinking is more difficult, right? Immediate gratification is easier to kind of connect with. That's an interesting question, Don. I wonder if he could be depressed and lack self-confidence. It could be some element of that, or it could be just this is a pattern that has worked prior. This may be one of the only ways to have immediacy of emotional feedback or emotional benefit. And therefore, it lends itself to you doing that because you have some level. Ironically, this is the challenge with hoarding behavior. Even though it may seem like that person is out of control in their behavior sometimes lends a sense to them that that's the only region in which they have control. Can you see that conundrum? Can you see that dilemma? That what may appear to be behavior that is so out of control in that person's eyes or their lens or their way of viewing the world, this is what I can control. I can control feeling good, even if it's for 5 minutes, by acquiring this stuff. I'll deal with whatever negative feeling comes after that because that 5 minutes of feeling good is better than having no emotions at all. Because the rest of my life may not in any way be lend itself to positive outcomes or positive emotions. Absolutely. Caffeine rush or crash. Yes. So it's important to recognize the loop. Think of the reasons people have for saving things and test it out. What we're going to ask folks to do or you should share with your consumers or your clients as a good way of practicing how they see those reinforcements across their behavioral patterns. I want you to select 3 possessions to discard or ask your client. Think of 3 things that are very simple, that are concrete, that you think you will discard, right? 3 things that we can both agree that you're just gonna get rid of. We want one to be easy. So a classic example is like some kind of mail that has no significance, one of those um, old menus or something that the person feels, oh, I've got 4 of those, I can get rid of the menu. The menu probably has changed since 2 years ago anyway, or the restaurant may not even be open, I can get rid of that. A moderately difficult one. For example, like a bill. Maybe the person has an attachment to paper items in the sense that historically they prefer to have the paper copy as opposed to electronic copy. They hold on to them. And then quite a difficult one, something that they have some sentimental attachment to. And then you ask that person, like we'll ask, how do you discard of your stuff? You have a donation bill, a waste bin, and a recycle bin. And you ask that person for those three items that you have, where do you think it's appropriate to discard them? Should one go into donation? Should this one go into the waste basket? Should that one be recyclable items? We want you to then ask the person when you're thinking of discarding these items, I want you to help me understand by describing to me what is happening? What feelings are you experiencing? What emotions are you experiencing when you're thinking of discarding this stuff? Do you feel that you're too attached to this item that we consider difficult to discard? Is it difficult for you to decide whether or not you should discard it or where you should discard it in? Is there a level of insecurity about making the decision and the decision not being the perfect decision? So we want you to help that person actually process those cognition, those emotions, those thoughts, those feelings before they make the determination about the behavior. So we want to take that person through the process. So once we're able to kind of go through that exercise, we want to get some feedback from this person. It's a great testing out exercise that you can ask that person to use. You identify the item, you ask that person to really talk about what is going on. Once they're going through that process and really get some tangible feedback from that person in a form that you can reference it because it's important for that person to really trace and to acknowledge what's going on in their brain, what's going on in their mind, what's going on in their heart, what's going on in their behavior that lends itself to either a decision or a lack thereof. And you may be surprised at the feedback you get. Or it may confirm some of the things that you believe. That person themselves may look at it and be like, oh, yep, I never thought of it that way. But the minute I had to discard it, I realized how much I look at that item and realize that I thought it was part of who I am. And I have a difficult time discarding it because I feel like I'm losing part of myself if I discard it. Really helping that person recognize and acknowledge the emotional processes that lend itself to the behavior or the lack thereof. And then there's a way of really helping that person understand it using the scale. So really take a look at this assessment tool or this exercise tool, and it has some really great evidence-based way of really helping that person understand clearly what their processes are for making decisions. And really reflect on the reasons for holding on to the item with that person. And there's some guidelines, there's some subject matter that the person can look at to get a sense as to why they want to hold on to it. And you can help them by identifying what category of challenges or impediment this fall into. Maybe it's an attention issue that prevents the person from really focusing on that item. It's a decision-making challenge. It's a categorization challenge. The person may have fears of making the wrong decision. It is in many forms. It's really a project. Yes, in our project, and it's really helping that person understand how their beliefs, their thoughts, their feelings really impact their ability to really make a decision or make a change or hold on to an item. How it's lending itself to them maintaining the clutter or increasing the clutter that they have. So it's really walking with that person side by side through their emotional um, scoping or screening of their own behavior. and ask them whether or not some of the reasons for making that decision or not make is familiar to them and why. Where did it come from? How long has this particular process been going on? How have they used this particular emotional processing to make decisions about their items or their possessions? And we have a list of resources that we want to lend to you in order to give you a good guide as to what some of the good guides that we talked about in session five, as well as the process of thinking it through and testing out the exercise. So we hope that today's discourse really lends itself to you having a good understanding as to how complex the phenomenon of hoarding is and to recognize it's more than simply just a person behaving in a way that's aberrant or behaving in a way that's negative, but really about the thoughts, feelings, emotions, and behavior that lend itself oftentimes to people holding on to possessions or having a really distorted view of the meaning that their possession have to them and why they should keep it. Hope that some of these resources are meaningful to you. As usual, as we wrap up, we want to ask you to take what you've learned and put it into practice. And we do that through the learning application, and we hope that you provide some feedback at our next session. So the learning application for February, we want you to try and share the worksheet to discard items. An easy item, a moderate item, a difficult item, and then look at how difficult it is for that person to make the decision about discarding it. I want you to come back with some feedback as to how it went, what was challenging, what worked, how were you able to process with that
Which ones?
person? What do you think about the processes? Remember, use the same link for next meeting. We'll meet again on the 26th of February, and we'll be addressing chapter 7, which is enhancing motivation. So we're going from truly understanding all the complex elements that lend itself to hoarding behavior to now taking a look at how motivated someone is to make a change now that they have a better understanding as to what has lent itself, what has contributed to their hoarding behavior, how can they tackle it with good sustainable motivational approaches to doing so. In the meantime, before you leave, if you can take a minute to provide us with some feedback as to how the session impacted you, what can we do differently, what are we doing well, what will you keep the same, how we can continue to make this training and this learning community responsive and meaningful to you so that it's applicable to you in your particular nuanced working environment or your living circumstances if you are a person directly impacted by hoarding. So take a minute to provide us some feedback. And in wrapping up, I want to thank you. We appreciate your time and attention and participation. Today's webinar, once again, was hosted by DBHR through the Washington Healthcare Authority. And we would like to remind you that the materials we provided to you, once again, we put it in the link in the chat, the link to today's presentation. And the recording will be provided to you, and it will be also available at some point on the FCS YouTube channel. Thank you so very much for your usual engaging and really informative approach to this. I hope that you have some tangible takeaway and this has been a meaningful session to you, a meaningful engagement. Look forward to seeing you next month. Just a heads up, next month, my colleague Crystal will be facilitating it. I will be providing support, but we're tackling this as a team, and it's been a great experience so far. We hope that you've learned a lot today and you have opportunity to put a lot into practice. If you have a question, it'd be a great time to ask a question. If there's any questions, certainly feel free to do so. If not, have a great rest of your day, and we look forward to seeing you next month. And in the meantime, take good care of yourself and each other. Thank you, Jennifer. Glad to hear you learning along.